You are live.
Here. Excuse me?
You are live.
We are live. Good morning. I'd like to call the Legislative Committee on Administrative Rules to order, August 12th, 2021. First item on the business is to review and approve the minutes of July 29th, 2021, and of July 1st. And while we're preparing to do that, ask the committee to introduce itself.
Senator Joe Benning from Caledonia County.
Senator Chris Bray from Addison County.
Not a member of the committee. Anthea Dexter Cooper from the Office of Legislative Counsel.
Trevor Squirrel representing Underhill and Jericho.
Mark McDonald representing Orange County.
Seth Blumgartz representing Arlington, Manchester, Sandgate, and Sunderland.
And Charlene
Carolody
Dindo
representing Burlington.
is in line. And we have on the screen,
Carolody representing Burlington.
Good morning, Senator Ginny Lyons representing Chittenden County. And because I am Zooming, I will not be voting.
oh, thank you. And first item on the agenda is the minutes of July 29th, the updated, and the minutes of July 1st. Right.
I move approval of the minutes of July 29 and the revised minutes of July 1st.
Mr. Chair, can we divide the question because I was not here for the July 1st meeting? I don't think you'll have a quorum if I'm not voting on that particular issue.
I wasn't here on July 1st either, but I will vote for them if there are others do, just so that we have the quorum can move it through.
The question, as I understood it, was we were going to revise them. Since I wasn't here, I don't know what the revision was going to be. Not real comfortable voting on a revision that I'm not.
Oh, might want to correct Odie.
Representative Odie.
Yes,
And
I
Sarah Lyons is not
I thought that I had been at the meeting on July 1st. I have it in my calendar that I was there, but after reviewing things with Charlene Dindo, I see that I was not there. So we are revising the minutes to show that I was not at that meeting.
You're putting it back.
So in the hearing, if I hear no objection from the committee members, we will postpone the minutes of both July 1st and June 29th until we have a quorum present and able to vote by members of the committee who were present at the various meetings. Objection?
Do we have a quorum for the July 29th minutes? Because I think we do.
Yeah. Yes. Yeah. Having heard of objection or correction, is there a motion to approve the July 29th minutes?
I'll amend the motion, just approving the July 29 minutes.
Senator Bray has moved to approve the minutes of July 29th. Is there any discussion? If not, all those in favor say aye.
Aye.
All those opposed say nay. And the minutes of July 29th have been approved. Which leaves us June, at 3 times different.
July 1st.
We've done July 1st and
No, we've done June 29th, July 29th.
we have, and July 1st is yet to be done. Well, what an auspicious beginning. First rule up for consideration, 21P04, Agency of Human Services, the rules governing the medication-assisted treatment for opiate use disorder. For Brenda Atwood, Public Health Policy Advisor for the Department of Health, is our witness. Is Atwood on the screen?
Good morning, Mr. Chair and committee members. Can you hear me all right?
Brendan, apologies.
No worries.
I'm off to, got 2 strikes and we barely started.
Let's see if we could do better starting now. Good to just jump right in, Mr. Chair?
Excuse me?
Okay, to jump right in right now?
Yes, the floor is yours to explain the rule and the parts of it that you feel need to be clarified or stressed.
Excellent. Thank you very much. So good morning, Mr. Chair and committee members. Thank you for inviting me to join you today. My name is Brendan Atwood. I'm a policy advisor with the Health Department. And with this filing, the department is proposing to amend the rules governing medication-assisted treatment for opioid use disorder. The purpose of this rule is to establish the minimum requirements for office-based opioid treatment providers to prescribe buprenorphine to individuals accessing treatment for opioid use disorder, and also to establish the Vermont-specific requirements for opioid treatment programs. And the changes made through this rulemaking seek to modernize and clarify the requirements for treatment providers. Specifically, this rulemaking would eliminate the state-imposed patient load limit, since these levels are determined at the federal level and they change periodically. Additionally, this rule will require providers with 100 patients or more to submit to the department for review a continuity of care plan checklist in order to ensure that they have an adequate plan in place for the continued care of their patients should there be an issue with the practitioner's ability to provide services. The department has also expanded the list of providers who can conduct the initial psychosocial assessment required by this rule to include primary care providers. And then finally, a number of language and formatting updates have been made to modernize and clarify this rule. And in drafting this rule, the department worked with MAT providers who are supportive of these proposed changes. So with that, I'll be happy to answer any questions that you may have.
Time for questions? Members of the committee? Senator Lyons. Senator Lyons?
No, I don't have a question. Thank you, Mr. Chair. And I did submit the form that this is consistent with statute.
So I have, in the absence of questions, we are moving from an absolute number for that is insured, an absolute number for the number of patients that can be covered, to perhaps a larger number with a greater field of people who are able to step in. Is that correct?
Well, we've expanded the list of folks who can conduct the initial psychosocial assessment, and that was based on some comments we received during the public comment period. We don't actually expect that this will drastically change capacity. We don't have a capacity issue in the state currently, and so really this is with regards to patient load limits. This is just aligning us with the current federal regulations. So we don't expect a big change in terms of capacity.
Would we be meeting today, reviewing this rule if the federal regulations had not changed?
We would. There were quite a bit of language and formatting updates that we wanted to make to modernize this rule as well as to clarify it. We also are newly requiring that providers with 100 patients or more provide a continuity of care plan checklist. So I think it's fair to say that we would still be here absent those federal changes.
Thank you. Are there any questions?
So given the sign off of the Committee of Jurisdiction and the testimony today, I would move approval of Rule 2104.
Senator Bray has moved that the committee approve Rule 21P04. Is there any further discussion? If not, all those in favor say yes. Aye. Aye. All those opposed say nay. And the rule has been approved by all five present here today. Which brings us to the second item on the agenda. Thank you. (21E11) VOSHA Subpart U Emergency Temporary Standard. Dan Whipple.
I'm not, is Dan on the line yet, Sean?
Yes, yes, I am. And I would respectfully defer to Mr. Anderson, who's actually in attendance to the meeting. I'll be here in case there are substance questions that can be answered that I can help out with.
Thank you. I was actually going to defer to Dan, but he deferred to me first. So Dirk Anderson, General Counsel with the Department of Labor. This is an emergency COVID standard. It was adopted by federal OSHA and under our state OSHA agreement with the federal government, and per statute, Vermont OSHA has to adopt standards that are as protective as federal standards. Therefore, we adopted this emergency temporary standard through the emergency rulemaking process. It applies to COVID safety precautions in healthcare settings. And the just slipped my mind. Oh, I know what it was. So we've discussed this in this committee before. Senator Bray raised some questions in connection with another rule. Up until the adoption of this emergency standard, VOSHA has been constrained in enforcing COVID specific standards in healthcare settings because they simply didn't exist. So we could only enforce safety violations through what's known as the general duty clause. This gives VOSHA a tool that's more specific when it comes to COVID safety precautions. And we did make some changes to the effective dates. Thank you, Anthea and Damian, for pointing that out. And that's really all I have. If you have any specific questions about the safety standard, then I would defer to Dan.
Senator Lyons.
Thank you. And thank you for the explanation. As I'm looking through the public input section, the administrative procedures piece indicates that this will be distributed through the Department of Health and others. And my question is, what role, if any, did the Department of Health play in reviewing this set of rules, since they do have a significant public health implication? Did the Department of Health review these rules? Are they consistent with what we're doing in the state?
We did share the emergency standard with the Department of Health. I don't know if, is David on the line? David Englander? I don't know if he wants to speak to them, but we did share them with the Department of Health, and they had no problems with them. But again, David's right there, so I defer to him.
Mr. Englander.
Mr. Chair, good morning, members of the committee. It's good to see everyone. So I just wanted to weigh in that we did review the rules and we're in agreement with them.
Thank you. That answers my question, and satisfactory answer. Thank you.
Are there any further questions for the witnesses or colleagues on screen? Senator Bray.
So I just wanted to, since we had talked about this before, the general duty to provide a safe workplace was what was guiding the response to COVID and the governor's emergency order. That's right. And now we, correct. I mean, it seems like there's a lot of expertise packed into this based on what's happened in the last year and a half in terms of definitions and all the rest. So it's a more explicit roadmap. So thanks for all that. I just have a question about where this week, this day, even, guidance is changing dependent on the health rate of spread in each county, stuff like that. Can you just say something about how these rules function when we're in such a dynamic environment? How to I'm just trying to understand a little bit how we make adjustments. We might have to make repeated adjustments, that kind of thing.
I think I would have to defer to Mr. Whipple on that.
Yeah,
Mr. Whipple?
basically, this rule is narrowly focused on healthcare providing, tasks. So direct patient tasks that could potentially expose healthcare workers and other workers of that nature to unvaccinated individuals. So because of the narrow focus and the comprehensive protections for those employees, the changing dynamic of the COVID situation that we have now would have no effect, because the rule anticipates that there is a high possibility or probability that employees exposed in these types of tasks could very well be exposed, and the protections are put in place with that anticipation. So we wouldn't anticipate in this particular field that this rule covers that the changing dynamics would have any effect at all.
One of the good question, if I may, does this rule have any bearing on the ability of an employer to mandate vaccination?
If I understand, I didn't quite catch all of your question. If I understand it, you were asking if the rule puts a barrier for employers to mandate vaccinations. Am I correct on that?
Just if it has any bearing on whether or not an employer may or may not choose to require a vaccination for all employees.
It does. The rule does anticipate that some employers might mandate vaccinations for their employees, and it does offer some exemptions to those employers that do that. And it also anticipates that there might be some reasonable accommodations in those types of requested in those types of situations, and it builds in some language to allow for reasonable accommodations in the case that an employer does mandate vaccinations of their employees, and an employee has a medical condition such as an allergy to the ingredients of the vaccination or something like that. It does allow the employer to reasonably accommodate that employee and still be under an allowed exemption.
Thank you.
Senator Benny?
Can I ask the question in reverse? Is there something about this that actually requires? I thought you said it accommodated, and my interpretation of this was that it was guidance being provided. Is there something about the rule that mandates employers to enact these measures?
The rule does not mandate employers to vaccinate their employees. The protections that are spoken of and built into this rule are in anticipation that not all employees would be vaccinated. And so the protections do not include mandate of vaccinations.
Okay, thank you.
Senator Bray?
I would move approval of Rule 21B11. If there's
Senator Bray has moved to approve the rule, and Anthea, would you share with us the date change that I believe is included in?
It would be the version that the Department of Labor already circulated. So you can just approve it as updated by the Department of Labor.
Okay.
And Charlene sent that to everyone, and it is included in your staff papers.
Senator Bray has moved that the rules be approved on the version that updates the dates within the context of the rule. Is there any further discussion? If not, all those in favor say aye. Aye. All those opposed say nay, and the rule has been approved. Thank you. Witness,
Thank you very much.
thank you. Which brings us to 21E12, Department of Health, Emergency Administrative Rules for Remote Hearings for the Department of Medical Practice. Witness David Englander. The floor is yours.
Good morning, Mr. Chair and members. I am still David Englander. I'm the Senior Policy and Legal Advisor to the Commissioner of Health. And I'm here before you with the emergency administrative rules for the remote hearings for the Board of Medical Practice. This is a renewal of an existing emergency rule that allows for the Board of Medical Practice, that is the board that licenses MDs, PAs, and podiatrists to practice in Vermont, to conduct hearings via remote, by remote means, in order to not have persons gathered in close quarters. This was adopted for obvious reasons at the beginning of the pandemic. And this emergency rule, this renewal, is a bridge between the soon to be filed permanent rule, so that there's no disruption. The rule itself, which you may have read, and it's important not to read this rule while operating heavy machinery. It provides for the process and conduct of hearings conducted by the board itself, so that the rights and obligations of all parties, including the board, licensees and attorneys and those representing themselves, is clear. The ongoing nature of the pandemic is such that it makes sense to give all persons an opportunity to be able to appear remotely. It also minimizes impact to providers who are currently engaged in the response. Over the course of the administration of the remote hearings rule, there has been no comments, there's been no concerns have been raised by the Vermont Medical Society or VAWS or other stakeholders. And with that, I'd happily take your questions.
Senator Bray.
Good morning, Mr. Englander. I have a question about the record, section 321. And there's a sentence in there that says the party requesting a copy of the transcript must pay to the board office estimated costs of producing a copy of the transcript. Can you say something about, one, what the ordinary costs would be, and two, how that relates to issues that this committee looks at around Freedom of Information Act and access and affordability of written records, et cetera?
That's actually a terrific question. I actually don't know off the top of my head. Typical transcripts for legal cases are approximately, and Senator Bennett could speak to this, but they're typically in the range of several $100s a day. I'm not sure how it relates to the board's practice. Many of these hearings are not public because they're investigations of private matters and matters that are protected by both state and federal confidentiality laws. But I'd be happy to look into that question and to ensure that we are complying with all requirements.
Are there any further questions? Senator Lyons.
Not a question, but I do think that as we have looked at this set of emergency issues through our initial legislation, that the Government Ops Committee did review the legislation. So I don't know if that helps Senator Bray or not, because I certainly cannot answer the question about the cost of transcripts. But I think having Mr. Englander perhaps provide some follow-up information might be helpful.
Senator Bray.
So I wouldn't want to hold up an emergency rule if to check that cost of transcripts and how often that happens. If there's something, urgent that needs addressing through the emergency rule. And I don't know if Mr. Englander can say whether or not, if we were to wait for that information, if it negatively affects your ability to do your job.
It would disrupt the rule. There would be a gap between the existing emergency rule if the committee were not to approve this.
Further questions? Mr. Englander, we are now operating, are we not now operating under an emergency rule that the rule before us would continue?
That is correct.
And,
I guess I was viewing Senator Bray's question, I suppose more broadly in that if the rule were not, if there was an objection to the rule, perhaps not a road we need to go down. I guess what I should have said was if the rule were not continued, there'd be disruption. But you're absolutely right, Mr. Chair, that the rule is currently in effect and will continue to be in effect.
So we have before us an emergency rule that continues the emergency rule in existence and will remain in existence until the permanent rule is comes to this committee and from yourself and others.
Yes.
Have you had any difficulties that in the areas that Senator Bray was asking about in the emergency rule in the months that have already taken place?
We have
already
not.
been in place.
We have not, and of course, this is an existing practice of the board that they would provide in this manner. But again, I'd have to speak with David Hurley, the executive director, to know how frequently what the cost is, if any, and how frequently they are requested.
So, thank you, Senator Bray.
So given that it's already current practice and there's not a record of objections or problems around that, then I would like to move approval of 21E12 and then simply ask Mr. Englander to provide that information at our next meeting.
I would be delighted to do so.
Senator Bray has moved that the rule be approved as presented. And is there any further discussion? If not, all those in favor say aye.
Aye.
All those opposed say nay. And thank you, Mr. Englander, both for the presentation and for your commitment to letting us know if there are anything crops up in this section of the emergency rule while we await the permanent rule. Thank you.
Thank you very much.
Charlene,
Yes.
our schedule for 2 weeks hence, do you have recommendations that we do not meet until?
I believe Andy and I talked about it. There's only one rule. So we could postpone until the 9th of September.
So were we to adjourn, you recommend we adjourn until the 9th of September when we will have a more robust calendar?
Hopefully.
Hopefully. Okay. Is there any other business that would come before us? Ms. Dexter Cooper, my apology for referring to you as Anthea, as our counsel, and welcome back. How old is the youngster?
9 weeks.
9 weeks.
Yeah.
Good to see you.
It's nice to see all of you. It's nice to be back in the building.
Just to make sure we don't end up with a quorum problem, just so people know this, I cannot be here on the 9th. I'm going to be away.
I have that.
But if I know you do, so make sure that if somebody else said, I'm going to be away too, and I'm going to be away too, then we want to talk about it now, but if not, then that's what.
So we have outstanding minutes, which for now, we need a quorum here for meetings in order to vote. And it's, as long as we have 5, we we can take actions. And thank the two members of the committee that were unable to attend today to be on the screen and be able to be helpful to ask questions and provide input. But we don't have 5, we can't do our work. So did you make a motion, Senator Britt?
Senator Lyons had her hand up.
I'm sorry, Senator Lyons?
I guess it's more of a question for when we're off YouTube. I was going to ask Anthea about her baby.